everyone. Thanks for joining us today for the Talent Series Part 1, Exploring ZoomRx Careers in Consulting. My name is Yanid, and I am the Talent Acquisition Lead here in the US, and my colleague Manisha is also on the call. She is the Talent Acquisition Lead in India, and we are excited to give you a little bit of insight into our consulting organization. We will start with an overview in ZoomRx and what we do. We'll talk a little bit about the career paths in consulting from both the US perspective and India perspective as well. We have two of our senior leaders on the call, which we will introduce to you very shortly, and they will get a chance to provide you with some additional insight of our consulting organization. We'll wrap up today by going through a typical interview process and what we look for in future ZoomRxers, and hopefully we'll have a couple minutes at the end for questions and answers. So we'll get started with who is ZoomRx. So here at ZoomRx, we are a life science consulting firm focused on primary market research and secondary data analysis. And we like to say that we make life science breakthroughs break through. We understand that bringing a drug to market is complicated and that the journey from groundbreaking concept to groundbreaking drug for our clients is littered with challenges and choices that shape the fate of their innovations. And so we are here to help them find clarity. We remove the complexity of bringing a drug to market by relating to the needs of our clients' customers, communicating the value of their brand, and we also help them answer important business questions across the therapy development and commercialization lifecycle. And we do this from very early stages all the way through post-launch commercialization. And some of our core offerings in those early stages, you'll notice are market potential assessments like TPP, BD target. Into some of those later stages, you'll notice profiling and positioning, as well as launch performance planning. And then in that post-launch commercialization space, we do a lot of promotional effectiveness tracking, performance tracking, and we do this through what we call the ZoomRx model. The ZoomRx model is a combination of our capabilities like our custom research arm, our brand builder team, and our newer commercial analytics capability as well, coupled with proprietary technology that we have built, like Firma, ZoomRx Digital, Percept, which hopefully through this ZoomRx model, we're able to provide our clients with faster results, deeper insights, real-time data, and better partnerships as well. We've been around since 2009. We actually started as WizRx, and in 2012 became what you know us as today as ZoomRx, when we focused on becoming more strategic market research firm and started really our period of growth. Have had some really great milestones along the way, with more recently in 2023, the launch of Firma Chat, and in 2024, where we acquired a small company called Vivisum that is now our brand builder team. We are more than 420 people worldwide right now, about 350 plus in India, about 65 in the US, with headquarters in Boston, Chennai, New York, and San Diego as well. We've had the privilege over time to work with more than 100 of the world's leading life science companies, and hopefully we'll continue to see this grow. And now I know most of you have joined us to hear a little bit more about the consulting team, so I'm happy to dive into that. Here at ZoomRx, we consider our consulting team to be one, and that is a comprehensive and collaborative approach between our US group and India group as well. So we do consider ourselves to be one consulting team focused on client delivery, insights first, data analytics, providing strategic recommendations to our clients, and oversight of project execution. That one team does have two types of positions. We have our delivery focused roles, which typically tend to be our entry to mid-level, focused on delivery, usually from the design of the project all the way through the execution of it. And then we have our senior leadership team from the management level up to top leadership, focused on deepening and expanding our relationships with our clients. Within those two, we do want to share with you what those career paths look like from the US and India perspective. And from the US perspective, it does look a lot more condensed. We actually start from a senior consultant position and have an engagement manager position as well from a delivery focused roles. And both of those positions are responsible for leading multiple projects and teams from the design phases through the through the project deliverable at the end as well. And that can be from a quantitative or qualitative perspective. And the engagement manager difference, really we use that position when it is a more complex engagement where it requires more senior expertise and more hands-on involvement on a project. The senior leadership team in the US starts at the senior manager level, goes into the associate principal, and then tops out at the principal. And usually these positions are focused on more of the business development aspect, although we are a seller doer model. So those projects that are sold by our senior leadership, they do oversee the delivery from there as well. As you move up through these positions, you become more heavy on the business development, but never lose sight of the oversight of the project. Now to go through our career path in India, these positions do start at the associate level, goes into a senior associate, then a consultant, senior consultant, engagement manager. Sounds pretty similar to the US. And then our senior leadership team is a senior manager, associate principal, and principal as well. The earlier roles, associates, senior associates, usually these are focused on more of the data collection, the pre-analysis, data quality checks, making sure that we have a summarization of the data, of the insights. As you move into a consultant position, you'll find consultants designing surveys, ensuring that we have themes for the data and insights, and that we are able to follow, we have a story flow and a narrative as well. As you move into senior consultant engagement manager, very similar to the US, where they will be leading these engagements. They will be client facing as well, anything from the design phase all the way through the project deliverable. Engagement managers, similarly to the US, are utilized on more of those complex engagements as well and provide that hands-on involvement as needed and more senior expertise. From a senior leadership perspective, we have senior managers, associate principals, and principals as well, and they are focused on ensuring that they're managing these long-term relationships with our clients from a quality delivery perspective as well. Now that you've gotten a little bit of insight into our consulting organization, the kind of roles that we have, I'd like to introduce to you our first guest speaker, David Johnson. He is a principal on our consulting team in the US. He joined us in 2021, has more than 20 years of experience working in market research, skills in advertising research, consumer behavior, and he's going to give you a little bit of insight into the US consulting team, what that team dynamic looks like, as well as the ZoomRx difference. So, Dave, I'll turn it over your way.
Thanks, Janine. So I just want to talk a little bit about, I'll start with the US consulting team. Janine mentioned this before, but I think one of the keys for us is this one consulting approach. And kind of interesting from my perspective over the last few years, like how we've evolved at ZoomRx to really, I think, tighten that up to where we truly have much more of a one consulting approach than we've done before. And I'll talk a little bit coming up about the ZoomRx difference, but I think that's one of the defining parts of ZoomRx is working as one cohesive team. On the US side for consulting, one of the big things for us is that we tend to be where the clients are. So we've made a big push this past year, maybe 2 years post-COVID to get back on site with our clients. So one of the things we're brought some of the India consulting team over to join us is to get more face time with the clients. It's definitely about deepening relationships with the clients, having a lot of calls, doing whatever we can to just keep in front of the clients, to deepen those relationships and really increase our footprint within each client and try to grow that way. One of the things we do with that time is try to add value where we can. So we do a lot of PET type of work, but we also do a lot of custom market research. One of the things we're always asking ourselves is what else? What else could we be doing for these clients? And by being in front of them more, by getting more time with them, that's been a big focus from the US consulting side. And as I say, and I think Rahul will talk to this too, and an increasing amount from the India consulting side as well. wanted to give a quick example of one of our clients is Astellas, and we've been trying to get our foot in the door at Astellas for a really long time. And Sarah Farina on the ECC2 team, she started calling them and just seeing if we could get meetings with them. We were trying to sell a PET into them, and using that sort of FaceTime with them. We couldn't get on site at the client, but we had, I think, 12 meetings over the course of 14 months before they finally signed on board with their first project with us. So some of it is being in front of them, but also some of it is just being persistent and trying to get that time as much as we can. In terms of the team dynamics, Janine did a good job, I think, at sort of going through the different roles. And I like the layout of having sort of the senior consultant into engagement managers more delivery focused, whereas the senior manager, associate principal, and principal tend to be a little bit more leadership focused. Definitely as I talk about relationships, but also balancing more of the selling efforts in with that. The EM role is probably truly like on a seesaw, probably the one role that's truly in the middle of that, starting to get more involved in the selling aspect as well as the delivery experience, whereas the senior consultants tend to be the true project leads on projects, especially for the day-to-day. Again, that goes for the US side, but increasingly that goes for the India side, and we have projects where it's very seamless regardless of where the roles are held. I think probably our best example of sort of the seamless approach from the consulting standpoint is with the multiple myeloma team at J&J. A year and a half ago, we were having a lot of quality issues with that team. Just a couple of things that somewhat blew up on us. We actually revamped the team to reduce the take a much deeper understanding about what they were looking for. Brooke, on the senior manager on the ECC2 team, really went out of her way to just get a better sense in terms of what are the clients' hot buttons, what else could we be helping them with, and then using the teams, both on the India and the US side, especially at the engagement manager level and the senior manager level, to really drive delivering on what those expectations are, to delivering more than what the client was asking for, really understanding their business questions. And I think the best example, and this is going to lead us into how often the clients will tell us when they look at something and they say, wow, like our call quality numbers seem like they're down over the last wave of research. And we've already done a look at all the data cuts to sort of answer that question. And the clients come back to us all the time and talk about that level of partnership that we have with them. So one of the things I ask myself with regards to what makes ZoomRx different is when I go out to former people that I work with and friends in the industry, and I ask them to come on board with ZoomRx, like what am I really selling? Because I believe in the company. And the differentiators that we tend to focus on, one is agility. We tend to play in the same space as ZS and other larger shops, but we do the same type of work in a much more agile way. If you add into that our technology and our AI focus, we're really forward thinking when it comes to our approach. So to be agile and to be tech focused, AI focused in this environment really differentiates us. I personally think the biggest differentiator with us is the insights focus. Again, there's the question we always ask of what, so what and now what. We tend to go beyond that here and say, like, beyond even the now what else could we be doing? How could we integrate the things that we're offering to our clients? And I think that integration really makes a difference. At a large client like Merck, we just won preferred vendor for the next 3 years where, based on the work that we're doing, they got rid of about a third of all their vendors. So getting that for this year really is a testament to that type of work that we've been doing. But for smaller clients on the ECC2 team, I'll give 2 examples, Genmab and Ipsen, smaller clients with a smaller product base that really still see that partnership and have been growing with us pretty substantially over time. So that's really it from my standpoint, from the US consulting standpoint. I'll reemphasize, I think that differentiation for ZoomRx makes a big difference. It really helps us get out in front of clients. It helps us sell initially, and it really helps us to resell based on those relationships, the insights, and the other things I talked about. And with that, I'll turn it back to Janine to introduce Rahul.
Thanks, Dave. Our next speaker is Rahul. Rahul joined ZoomRx in 2022. and has since taken over a pivotal role of principal and India. With over 18 years of experience, Rahul has been instrumental in transforming our India-based consulting team. Under his leadership, the team collaborates directly with over 40 US-based pharmaceutical companies, including 16 of the top 20 in the industry. Together, we tackle more than 100 projects focusing on brand insights and analytics, ensuring that right structure, roles, and capabilities are in place for success. All over to you, Rahul.
Great. Thanks. Thanks, Manisha. Thanks, Yaneen. Can you guys hear me okay? Yeah.
Yeah.
Okay. All right. So I think they've covered it really beautifully in terms of the consulting team's overall makeup, the look and feel of it, how we operate. So I'll just zoom in a little bit into these three aspects, folks, and more India specific, obviously. That's where I'm located as well, and looking after this team that Yaneen mentioned, about 150 odd folks here in the consulting. So first thing first, we are organized with a very client-centric approach is the first thing I wanted to share. What do I mean by that? There is a very specific set of 4 or 5 clients that form into a group of team members working for them on their projects. And that focus brings in a lot of depth. That focus brings in a lot of right uh, structure and approach towards the specific projects and the specific brands that we are handling for that specific client. And I don't know if you mentioned it, but we have, like we said here, 16 out of the top 20, as well as 40 plus more that we work with from the pharma world. So it's a large spectrum of clients that we work with. And obviously our big focus is always going to be on the top guys, but we go deep into various other uh, clients across the West and the East Coast as well. And our teams in India are formed around them, specifically formed around them. So that's the unique thing about us. What does the India team drive itself off of? So I'll say a few things. I think the biggest one is depth and end-to-end expertise. So when we talk about a project, for example, of any kind for the specific brand that we are working with, the India team along with the US team on that project will truly go deep into that specific question, that specific practice, the data behind it, etc., as well as go from start to end, right from the point of actually pitching till the point of giving the final outcome and giving the final presentation in front of the clients. And just like Dave mentioned, we do this as one team. We're together in that room with the client or on that call with the client, taking them through the project process. The other thing I'll mention is there is the very clear and simple unit in which we measure our success, and that's the project. So in India, we are extremely project focused. Of course, that means we are client focused. But this whole aspect of success of project is super critical for us. I'll differentiate one thing that I've seen across the industry versus here at ZoomRx, and that is presence across all levels into the depths of the work. So it's not as much, up to a certain level, you're looking at every single aspect of it and sometimes even taking it all the way to the client, and seniors will jump in only when needed. No, we have a much more regular, much more frequent connect across all the team members uh, on any project. So that's another differentiator. The key skills, this is important for maybe this audience, the key skills that we look for typically on our project team members when we look for folks to join us is truly very simple as well. Few things that I'll mention, and there is more, but few critical things is around the ability to have comfort slash handling of complex data, comfort around working in analytics, complex analytics sometimes, and analytics as a spectrum of simple custom stuff all the way to sometimes complex AI as well that we can bring into our projects as needed. That comfort is also something we look for. So data complexity, analysis complexity, comfort with that, and finally structured communication. So if these three things are something that you enjoy and feel like you have strength in, I think that's the kind of fit we look for when we think of folks who join us. Second thing, building a career. I would spend a lot of time here, but we talked about this one team approach. It involves, systematically, structurally also to act like one team. And for that reason, building a career in ZoomRx is almost exactly the same for whether you are in the US or whether you are in India. Consulting team has one career path, just like Yanni showed us. You start from an associate all the way to principal level, but the path is same. It's just that we start at a senior consultant level in the US, while in India, uh, we have positions even before that, where junior project support team members can join us. But the path is same. Um, we look for, like I was saying, that project success evidence, the project impact evidence as people move through levels and roles in their career at ZoomRx. Uh, and that's the simple path to growth. You grow through your strength on client delight, outstanding project outcomes, for example. And then again, as you grow, Yanin mentioned this, I guess, as you grow further, building strong teams becomes a very important aspect of your focus as well. So that's the career path. I feel that's the growth kind of drivers, if you will, at ZoomRx. And like I said, it's very, very similar. It's kind of a common career path that we have created to act like one team as well. Now, finally, US-India collaboration. Now, this is really day to day, right? And we take a lot of pride, like Dave was mentioning, we have made this transformation towards getting closer and closer over the last several years towards this approach of high collaboration, one team approach to take our work to the clients. Now, what does that involve? I think that involves mainly few simple tactical things like I notice, at least in my experience here at ZoomRx, compared to what's out there in the industry, a much higher frequency of interactions is something we have consciously brought in between US and India and across the levels. We've started, like Dave was saying, traveling across the shores quite a bit after COVID allowed us to go back on that track. So now we're doing that quite frequently, including, of course, when client has time together going and seeing them. And that sort of an approach has actually given us the opportunity to blur the boundaries. Clients, of course, don't care, by the way, but we have blurred the boundaries for ourselves uh, in terms of the geography. And naturally, since our time overlap here in India with the client is lesser than US, we will have much more planned and kind of well in advance uh, uh, established meeting cadence with the client versus in the US, you can have much more ad hoc, hallway, etc. kind of discussions with the clients. But then when the teams come together, there is a lot of discussions, etc., coming on the same page, and then again going together in front of the clients. So we have made this practically as real as possible that at least I have seen in the industry in terms of working like one team with a heavy element of collaboration, heavy element of, by the way, tandeming with each other in terms of tasks and objectives. So US team will work through a certain specific set of hours. India team comes in after that. So there is this whole cycle that we established where it's not so much as we draw the line here, then we pass it from there, then the next person passes, etc. So that is something that we have definitely very carefully, consciously avoided as our operating model. So yeah, that's about India. There's a lot more that we can discuss if you guys have questions, but that's all from my side. Any, Manisha?
Thanks, Rahul. Hi everyone, I'm Manisha. I oversee talent acquisition for ZoomRx in India, and I'll be walking you through the hiring process. I'll try to offer some insights and tips on how you can join our dynamic team. At ZoomRx, we believe that hiring process is not just about us evaluating you, but also you getting to know us. So our interview process is also designed to be thorough and insightful, allowing us to get to know each other better. We focus on, when we talk about consulting org and what success in each of the roles that we discussed earlier looks like, we focus on three key aspects, and all of the three key aspects contributing to one common goal of client satisfaction. First one is the client servicing. This involves us trying to understand our clients' needs deeply and deliver tailored solutions that exceed their expectations. Next is flawless execution. We value precision and excellence in every project we undertake, so we ensure that every detail is meticulously handled. Next is the impactful deliverables. Our ultimate goal is to provide deliverables with significant impact for our clients, helping them achieve their business goals. While these three aspects are consistent across all the roles in the consulting team, the experience level and the expectation of the responsibilities will vary depending on the specific role and your experience level. Our hiring, next slide, Our hiring process consists of 4 main stages. Each of it, again, is designed carefully to evaluate different aspects of your skills, experience, and overall fit for the role. It starts with an application review where we review your application to understand your background and experiences. If your application aligns with our requirements, we schedule a phone screen to get to know you better and discuss your interest in the role. It's followed up by an online assessment. Candidates who pass the phone screen, they're invited to complete an online assessment. And again, this also is designed to test the relevant skills and competencies that are crucial for the role. Post this, there's typically a case study where you will be presented with a business problem to solve. Again, this allows us to see how you approach problem solving and apply your analytical skills in real world scenarios. Finally, in the fitment round, we assess how well you align with our company's culture and values. This is again critical because this helps us determine if you will thrive in our collaborative and dynamic environment. After these stages, we make a final decision based on your performance throughout the process. Again, each of these stages, it is designed to be thorough and insightful, to help us get to know you and know you better, and for you also to learn about ZoomRx. Next, I'll provide you with some tips on how to prepare for each of these stages and what we look for in an ideal candidate. It starts with a phone screen. At this level, we look at 3 aspects. One is industry proficiency. Our aim is to understand your knowledge and experience in consulting and healthcare industries. This helps us gauge your familiarity with industry-specific challenges and opportunities. Next is your interest and motivation. We want to learn more about your interest in the role and your motivation for wanting to join us. This is where it's your chance to showcase your passion for consulting and explain why you believe you would be a great fit for our team. Finally, it's communication and problem solving. Again, effective communication is crucial for all of your consulting roles. We try to assess your ability to articulate your thoughts clearly and coherently. Additionally, we evaluate your problem-solving skills as well through some situation questions to see how you approach and resolve challenges. Again, phone screen, it's a critical step as this is going to set a stage for your subsequent stages in the interview process. So preparing well for this round, it's going to increase your chances for moving forward. Next, we'll talk about the assessment. So we use a platform called Tableau for all of our assessments. It's a comprehensive online evaluation, and there are 4 key sections. Starts with a cognitive test, where your cognitive abilities, including your quant, logical reasoning, and verbal abilities assessed. It's followed up with a written assessment. In this part, we evaluate your written communication. You will be asked to write a response to an essay or a given topic. It allows us to see how well you can articulate your thoughts in writing, again, which is impactful for creating impactful reports and presentations in consulting. The third section is problem solving. This is a case study based section wherein various scenarios are presented to you to solve. Again, helps us gauge your critical thinking and your ability to apply your knowledge to real world scenarios. The last section in the assessment is a video interview. Again, this is a behavior-based, scenario-based video interview. A couple of pre-recorded questions, series of pre-recorded questions will be asked, and your ability to use your verbal communication and your ability to think on your feet and your overall presentation is assessed here. This assessment again is designed to be rigorous and comprehensive. Hence, it's a 2-hour long assessment. But then it ensures that we get a well-rounded view of your skills and potential. And we encourage you to utilize the practice test that is available at the link that's on your screen right now. I'll pause there for a bit for you to make a note of it. Next, we'll discuss the case study stage, where you will have the opportunity to demonstrate your analytical and problem-solving abilities. During the case study stage, we look at evaluating several competencies. First one is your ability to accurately identify and define core problems. This shows us how well you understand complex situations and pinpoint any primary issues that need to be addressed. Next is strategic thinking. We assess your capacity to think strategically by looking at how you approach the problem and develop a plan to address it. It involves you considering various options, anticipating any potential challenges, and outlining a very clear and logical strategy. Then we look at your data-driven approach. In consulting, making decisions based on data is essential. So we evaluate how effectively you use data to support your analysis and recommendations. Again, this includes gathering relevant information, analyzing it accurately, and drawing insightful conclusions. Finally, your ability to communicate your findings and recommendations is critical. We look at how well you organize and present your ideas, ensure that they are clear, concise, and compelling. Again, this demonstrates your capability to influence and persuade stakeholders with your insights. The case study, again, it's a very integral part of a hiring process as it closely mirrors the types of challenges you will face in a consulting role at ZoomRx. It allows you to showcase your analytical prowess, strategic mindset, and communication skills in real-world scenarios. The final stage in our hiring process is the fitment round and then the final decision. During the fitment round, we focus on, again, several aspects. First one is your culture and team alignment. We try to assess how well your values and work style align with our company's culture. Again, this includes evaluating your adaptability, teamwork, and how you embody our core values in your professional conduct. Second one is the purpose and foresight. We look for candidates who have clear sense of purpose and long-term vision. This again involves you understanding your career aspirations, how you see yourself contributing to ZoomRx, and your ability to think ahead and plan for future challenges and opportunities. Finally, it's work environment and team dynamics, where we consider how well you fit into our work environment and team dynamics. This includes your interpersonal skills, ability to collaborate effectively with your colleagues, and how you contribute to a positive and productive work atmosphere. Again, this is a critical round again, which helps us determine whether you will be happy and successful within our organization, and also how well you will integrate with our existing teams. Then a final decision is made after completing all of the stages, and based on a comprehensive evaluation of your performance, again, including your skills, experience, culture fit, overall potential to contribute in the team. Again, our goal is to ensure that we bring in broad individuals who are not only highly skilled, but also aligned with our mission values, ensuring that there's mutual growth and success. To sum up, these are two aspects that will make you successful at ZoomRx. I will leave this slide on there to them. Thanks for paying attention. I hope this overview of hiring process was informative. Yanni, do we have time for questions, or do we take it up?
Thanks, Manisha, for going through that. It looks like we are over our time by 4 minutes, but what we're happy to do is if you do have any questions for us, feel free to drop them in the question box. We will save those and email everybody with those responses in a little bit more detail to give you some insight into that. So if we do have any questions, please trickle them in through the chat box, and then we will be sure to get back to those. But if you don't have any other questions, if you don't have any questions, we encourage you to either submit an application with us and go to our zoomrx.com/careers webpage, check out what we have available. Or if you have any specific questions that you're not able to write into the question box, feel free to reach out to us at recruitment@zoomrx.com. We do plan on having more of these series in the future, and we thank you very much for joining us today.